chat with us and to chat with others who are on the call. A lot of you are joining for that reason, or that's one of the reasons you're joining. But we wanted to talk today with our trainers who have joined us about where we are with presenting and the spread of the training itself. So we're going to look at some of the data, which I imagine some of you have contributed to, which we really appreciate. We're going to talk about some of those current outcomes with the most recent batch of 6-month follow-up data and some historical data about what is going on across the country. And we are going to talk some about some of the updates that we've done, including giving you an overview for those of you who are trained on previous versions, so anything below version 4.0, what those changes are, and for those of you who were trained on version 4.0, what some of the upcoming smaller changes are going to be, and we're going to talk about next steps. And I'm deliberately drawing out my intro because every second it ticks by another person joins us. So just going to kind of hang out here for a minute or so and see if that number stops ticking up, and then we'll start with the 6-month survey data presentation. So Amelia, let's just give everybody another minute or so, knowing how long it took me to sign into WebEx, so that our folks who want to join us don't miss too much of the presentation.
Sure, no problem.
All right, well, it looks like we are plateauing. So for those of you who are just joining us, we just opened the presentation and talked a little bit about what we were going to be speaking about today. I don't want to delay any further. So the first part of our presentation is going to focus on some of the data that were gathered from the latest administration of the 6-month trainer follow-up survey. And as I mentioned before, for those of you who weren't on the phone when I mentioned it, I suspect many of you, most of you, contributed to these data in some way, shape, or form. So we really appreciate your continued responsiveness to our requests for information, and it's really helpful for us, and hopefully will be helpful for you too, to understand some of how the training is being used across the country. So we go to the next slide. So this map gives you a sense of how the volume of trainers who responded to the survey by state. So this is the 627 people who indicated the state that they were trained in. Not everybody did, but for those who did indicate that, this gives you a sense of where people are coming from, or at least where they were trained. So you can see by the different pin drops that in almost every single state, we had at least one person respond to the survey. I will say that if you stuck a pin in Georgia, even though we didn't have any responses from there, it would accurately represent our spread of trainers. We now have trainers in all 50 states, as well as in Guam. And I believe we were in Puerto Rico as well. From a couple of years ago, we did a trainer there. But none responded. So we are everywhere with the training. So you're not alone in terms of being trainers within the country. And you can see that in some states there's a greater density, at least of people who responded to the survey than others. But we're definitely across all 50 states. Next slide. So some of the information we collected has to do with recent trainings, others has to do with historical trainings. This is a question we asked of the people who responded to the survey. So there were 798 people who responded to this particular question on the survey. And this question was asking, how many trainings did you, the person who's responding, conduct in the past 6 months? And just about half of those 798 respondents reported that they had delivered the training at least once in the past 6 months, with many of those folks, about a quarter of those folks, having done 2 or more. So you can see a little over half of people had not conducted the training at all in the past 6 months. About a quarter or 21% of people had delivered it at least once, and about another quarter of folks had delivered multiple deliveries in the training in the course of the past 6 months. Since these data are from April 2020, there might be a little bit of an impact of the pandemic on the number of deliveries, given that the last month or month and a half of the reporting period was when COVID-19 hit, and we were all dealing with that. But that's a pretty good number of trainings recently within the past 6 months on behalf of the folks that we've trained. Next slide. So we also asked, since you've been trained as a trainer, how many total number of deliveries have you been able to conduct of the training since you were trained? So there were 793 people who responded to this question, and about 70% of respondents who have delivered at least one training since their event. Almost 2/3 of those reported delivering their first training within 6 months following the TTT. That's great. If you remember back to your TTT event, that we encourage you to deliver the training as soon as you possibly can following the training itself. So a lot of folks are having the opportunity to do that. So that's very encouraging. Of those who had not yet delivered the training, so that about 1/3 of folks who have been trained but haven't had a chance to actually deliver it to an audience, the majority of those folks reported that the reason that they were unable to do the training was either because they didn't have time to do it, or that there wasn't an appropriate audience or venue to which to present. And then of those also who had not delivered the training, so again, that about 1/3 of the respondents who've been trained but haven't yet had an opportunity to deliver it, almost all of those folks, the vast majority of those folks, reported that they do still intend to deliver it at some point in the future. So even among the folks who haven't had a chance to deliver the training, they're still very much interested in delivering it and wanting to get out there and do it. So that's encouraging. Next slide, please. So we also asked a couple of questions, and these are kind of subjective ratings for sure, but asked questions of our trainers about any behavioral or systemic changes that they've noted that has been or have been a direct result of providing the training or participating in the train-the-trainer program. You can see by the number who responded to each of these questions that not everybody responded, so only about a quarter of the survey respondents responded to these two particular questions. But out of the, around 225 plus or minus who responded to each of these questions, about 16% reported both having observed behavioral changes among staff as a result of the training or TTT, and that there were systemic changes in policy or procedure implemented within the agency as a direct result of the training or participating in the TTT. Given that these are pretty subjective data and observational and, weren't collected in any sort of systematic way, that's pretty encouraging that in over 15% of the cases, or at least from the trainers who answered the question, that the training has had the intended impact from their vantage point and from their ability to observe changes. Next slide. So in summary, there were 368 of the trainers who responded to the survey indicated they delivered at least one training in the past 6 months. And across those 368 trainers, there were a total of 799 training deliveries reported. So that's a pretty big spread. And if you take a look at the note there that's at the bottom of the slide, the way we collected this information was that if there was a trainer who had delivered 5 trainings or more, that was lumped into one category. So that number 799 is in reality probably a bit higher because I know that there are some folks out there who are doing even more deliveries of the trainings than 5 in a 6-month period. So that's a great number and represents a pretty broad spread just over the 6 months that we inquired about of the training itself. Of the 368 trainers who delivered at least one training in the past 6 months, 82% provided additional detail regarding the events that they delivered. And from those 302 trainers that did provide that additional detail was provided on at least 639 events, probably, again, a little bit more because of the categorical nature of the 5 or more category. Or 80% of the total number of trainings delivered in the past 6 months. So this next slide is based on data provided by those 302 trainers who gave additional detail about the 639 training events that they had delivered in the past 6 months. So you can see some interesting statistics here about the number of attendees, how the training was delivered, the audience, and this might be helpful to you all as you're looking at what your experience was compared to the 302 trainers here that provided details about their delivery. You can see that there was a range of the number of attendees at each event, but generally within the range that we recommend. We recommend somewhere between, 10 to 35, 15 to 35. And that's generally where most of the trainings fell within that range, but there are people who certainly did more than that. And in fact, 7% of the deliveries indicated that there were more than 50 people present. And we talked about that during the train the trainer about how you can do that and modify some of the activities. So some folks were able to do that. So that's great. About half and half in terms of whether the trainers delivered with a co-trainer or not. And in terms of the general audience for the training of those events that were details were reported about, interestingly, about a little over a quarter had as a primary audience for the training community corrections professionals, which is not surprising. We've done a lot of trainings with probation, parole, pretrial services. The second highest group that was mentioned there, and actually if we combine mental health and substance use services into that kind of, behavioral health category, we've got about just about a third, 30% of the audiences being treatment staff, and in addition to criminal justice professional staff. So that's encouraging. A lot of attorneys, so I was a little surprised that was quite as high as it was there, but happy to see that. And then we take a look at the other statistics. But just some interesting statistics about who the audiences are and how the training is being delivered, and some food for thought about your own deliveries as you move forward. Next slide. So now I'm going to turn it over to Amelia, who many of you know, or at least her name sounds familiar. She is our current coordinator for all of our trauma-informed responses training, and she's going to talk about some of the changes to the curriculum and some of the things that are coming up this coming year. Amelia?
Great. Thank you, Chan. And I just wanted to bring up, while I am going to cover the changes that we've made to version 4.0, I also want to bring up a document that you guys are welcome to download and kind of follow along that has a little bit more detail of what I'm about to cover. Likewise, this is in the trainer portal, which is something else I'm going to talk about momentarily as well. So you can also access this there. But you might see that there's a little download option here. So feel free to click on that file And once you click on it, it will allow you to download the file to your computer. But getting into some of these changes, this slide is just going to cover some of the more general changes, and I do have some more specific module changes coming up shortly. So we have made some slide changes throughout the entire curriculum. Most of these are just having changed some of the visuals that are there. You know, the benefits slide of the female officer covering her, crossing her arms is one. The trauma rates are very high slide is another one I can think of. The risk and resilience. There's a lot of examples of where we've changed some of those visuals, but the content itself is the same. We wanted to make those changes to make a more visual impact so that people that you're training can kind of grasp the material even better than how we had previously. So please feel free to go on the trainer portal and look at the new presentation and just see what those visual changes are. Similarly, we have added some new information in a couple of the modules, which I'll get to momentarily, but we've also edited some of the trainer and content notes throughout the trainer guide. So some of them we've just edited a little bit, some of them we've replaced and updated. So there's a little bit of a mix of that through some information that had been there in previous versions that just is a little bit updated. And you can get all of that super specific, granular change information in that document that a lot of you have clearly already clicked on, so that's good. Similarly, the lengths of modules 2 and 3 have changed by 5 minutes, and I'll explain how and why we did that in just a moment. But module 2 had previously been a 50-minute module, and now it is 55 minutes. And then module 3 had previously been 35 minutes, and we've shortened that down to 30 minutes. So those are just some time changes that you'll want to keep in mind for when you train version 4.0 in the future. And then the fact sheets I want to cover because we have created a new fact sheet, which was based on the information that was previously a part of the module 6 activity. We have reconceptualized that activity, but we didn't want to completely lose that information because clearly it's very beneficial info. So we just turned it into a fact sheet, which you can now find in the references and resources section at the back. So all of that information is still available. So if you use that a lot, please don't worry. It's still available for you to use and train people in. And then the childhood trauma fact sheet, we just added some information to. A lot of people are aware of the Adverse Childhood Experiences Survey. A lot of you, I imagine, are probably incorporating some of that information into the training. But we wanted to add a little bit more to our fact sheet on the ACEs, and specifically this ACEs pyramid that we had taken from the Centers for Disease Control and Prevention website, which is just a really great visual of that hierarchy of needs specific to the questions posed in the ACEs survey. So then this slide is a little bit more specific to the module changes. So as I had mentioned in module 2, we have increased that module by 5 minutes. And that is because we've added information and 3 new slides on vicarious trauma. So we had, there was a little bit of information included on vicarious trauma previously, but we wanted to be much more intentional about this information so that you guys can be very clear on what vicarious trauma is, which is the first slide, who it affects, which is the second slide, and how it affects people's work performance, which is that third slide. Likewise, we have certainly added some trainer and content notes to those slides to give you as much information as possible. So that's part of where that 5 minutes has been increased because we now need a little bit more time to cover that information. I will say, having done this training throughout the summer with version 4.0, that has been more than achievable to get that information within that 5 minutes. In module 3, that was another module that the time has changed just a bit. It had been 35 minutes. It's now 30 minutes. We have added some information, again, specifically on the ACEs survey. So we did add 1 slide on that and a trainer and content note to the trainer guide to orient you to that survey if you're not as familiar with it. But where we were able to take some time back and give it over to module 2 was really in the trauma effects videos. So previously there were 3 videos that kind of walked through the slides throughout that module. And we had decided to consolidate those 3 videos into one, as well as edit a few little things out that weren't quite as important, some pauses, some, people just kind of speaking over themselves a little bit. And so we were able to make that video a little bit shorter to take some time away. Likewise, because you don't have to introduce each video 3 separate times, you don't have to debrief the video 3 separate times, you also add some time back in that as well. Because we had changed those trauma effects videos from 3 to 1, that learning check slide has also changed slightly. Instead of one learning check slide that follows each one of the 3 videos, there's now just one learning check slide that follows the one video, but it does include all of the information that had previously been incorporated in the 3 separate learning check slides. Likewise, all of that information that had been included in the trainer guide under those learning check slides have now been incorporated into that one learning check slide. And then Module 6 is where we've had the most change to this version. So we have reconceptualized the Module 6 activity. The general purpose of it has not changed. We still want people to take about 5 minutes to identify a policy, practice, or procedure that could possibly be reimagined as more trauma-informed. And then you spend next 5 minutes brainstorming the ways in which that policy, practice, or procedure can be more trauma-informed. So the purpose hasn't changed. However, we have structured this activity by the sequential intercept model. And so we have added a slide that incorporates the sequential intercept model, as well as trainer and content notes for you all to familiarize yourself with what that is if you're not already familiar with it. Similarly, that slide is a good slide to kind of get people oriented to the SIM in terms of where they work, because that's how the activity is going to, how it's going to be conducted. So when you hit that sequential intercept model slide, you might just want to tell them, as you're looking at this sequential intercept model, think about maybe which intercepts you work most frequently in, and kind of get them in that mindset that that's what they're going to want to think about in just a moment. When you do hit the activity slide, which will come right after that sequential intercept model slide, that's when obviously you're going to provide the full instructions, you're going to explain what the activity is in detail, and then you're going to break out the groups slightly differently than previously. So in the previous modules, we had these the groups broken out based on role and responsibilities. So there were all those green cards for law enforcement, behavioral health professionals, peers, all of those things. And now the groups are being broken into intercept groupings. So if you're not familiar too much with the sequential intercept model, it is a linear map of how the criminal justice system flows, and there are 6 intercepts, 0 through 5. So for this activity, we've decided to break the groups up into intercept groupings, of which the first group is comprised of intercepts 0 and 1. The second group is intercepts 2 and 3. And then the final group is intercepts 4 and 5. And so in terms of breaking those groups up, if you have a group of people from various places of work that might be on that sequential intercept model, you might have some patrol officers, you might have some drug court staff, you might have some probation officers, people who kind of filter across that whole sequential intercept model. You can ask them to think about which part of this sequential intercept model they work most frequently in, and that's how you can break up the groups. I will add that throughout this summer when we've done this training, for those people who tend to kind of work over what might be all of the intercepts or a few of them, and they might have a harder time determining which intercept grouping makes the most sense for them, I will frequently ask them, is there a certain project or task that you want to work on that specific project is more specific to one of the intercepts? For example, someone that I had been speaking with was a director of a behavioral health agency out in the Midwest, and she was someone who, quite frankly, could fit across any one of those intercepts based on her workload. So I had asked her that question, and she said, yeah, you know what? We're developing a new treatment court out here, and I think I'd like to put my attention on that. So it was a really quick decision for us to put her into the intercept 2-3 grouping to focus on that new treatment court. Likewise, If you have more of a homogeneous group where maybe everybody is a probation or parole officer, you're welcome to have everybody just kind of think about the activity based on the Intercept 4 or 5 grouping, but then you as a trainer will want to make sure that you cover the information for Intercept grouping 0, 1, and 2, 3. Or you can essentially just assign Intercept groupings to those people if it's a homogeneous group. All of this information is in the trainer guide as it was previously with the other groupings, so feel free to please go to the trainer portal and look at this more specifically. But I did want to give you an idea of how you can break up those groups. So when you do end up breaking up the groups, they've done their 5 minutes of identifying a practice, policy, or procedure, and then their 5 minutes of brainstorming ways to make that more trauma-informed. You're going to process the learning check slides similarly as you had done before, except that the learning check slides have changed a little bit, as you may guess, because the structure has been changed just a little bit. So when you're done doing the actual activity, the first learning check slide you're going to see is for Intercept Group 0, 1. So you will want to make sure that the people that are completing the activity for Intercept 0, 1, that they report out during that slide. And then the same with people who had done Intercept 2, 3, and Intercept 4, 5. We completely got rid of the green cards for this reason, so you don't need to worry about those. We have added a sequential Intercept model, one-page document to both the participant materials in the trainer portal as well as the trainer guide itself for you guys. But so all of your participants will have that sequential Intercept model in front of them, both as a one-page document on all of the information of what the sim is, as well as in their activity packet for when they're actually completing the activity. They'll be able to have those intercepts right in front of them to reference. And then finally, we had removed the closing module entirely. So there's no longer slides for the certificate, the evaluation. The final slide is at the end of Module 6, and it's simply the contact information. So if you were someone who had been trained by GAINS, it'll have the GAINS information in the back. And if you were trained by PRA or PRI, that information will be the final slide of Module 6. Okay. So now I'm going to turn into our next steps and upcoming opportunities. We are still working on this training. It's a curriculum that never quite stops being shaped and formed because obviously we learn more information each day about trauma and what might be helpful to add to the curriculum. So we will be adding in 2 more slides that are going to touch specifically on diversity, equity, and inclusion. One of those is going to go into Module 4, and another slide will be going into Module 5. Likewise, content and trainer notes will be added to support those slides as well. Every trainer trains this curriculum slightly differently based on your role, your community, the audience you're training, et cetera. There are many more variables to how and why people train the curriculum the way they do. But we wanted to be more intentional in how we included this information, as it does have an effect for people of color, particularly in how they interact with you all as criminal justice and behavioral health professionals. So we want to reinforce that we believe it's important to apply a race equity lens to the delivery of this training in order to more effectively address the issues of trauma as it's experienced at historical, community, and personal levels. This will result in a better training experience for your participants and can also help equip future trainers with the insight and language they need to address diversity, equity, and inclusion in their training deliveries. So that's forthcoming, and we hope to share that with you in the next few months. Going down on these bullets, we do also have some new support resources for version 4.0. There's a whole new trainer guide in there that you're welcome to click off and print off if you'd like to. In fact, we'd hope that you will, so that you start training version 4.0. Likewise, there are some new participant materials like that sequential intercept model one-page document I mentioned is in there. There's some new trainer materials in there that are specific to version 4.0. The 2 things I want to mention as you do if you go over to the trainer portal following this or if you're there right now, that you might notice that the module talkbacks and the presentations that we film of CRA staff conducting the trauma training are not up there yet. Unfortunately, the day we were going to film the version 4.0 modules was a week following us all going home due to COVID-19. So we were not able to film those yet. We do hope to do that sometime, probably next year, but kind of as soon as possible. However, the module talkbacks, which are the slides specifically with someone just speaking over them, giving you the information that's specific to each slide, that is something we're able to do virtually. So we will be putting together the module talkbacks in the next couple of months so that hopefully it'll be up there before the end of the year so you can reference those as well. So those two things are forthcoming, but all of the other support resources you need to train this particular curriculum version are on that trainer portal already. So our next survey that we're going to release, that 6-month survey that Chan had done, explained to you how the data came back to us, which is, it is really exciting to see what we're seeing from that data. That new survey will be released later this week. I didn't want to overwhelm everybody with multiple emails, but I will be releasing that later this week. Although we recognize that COVID-19 has probably altered how frequently you train this training, if you've been able to train it at all. We kind of expect to get some different results this time around, but please do complete the survey. It's really helpful for us to see how it's going for you guys and what you possibly might need from us. So please take a few moments to complete those surveys when you do get them. And then finally, I just want to mention our upcoming 2021 GAINS Trauma-Informed Responses Train the Trainer solicitation. So we are in the tail end of putting together our solicitation for next year's training event, and that will be released shortly in the next few weeks. So if you are part of our GAINS listserv, you'll see that come out. If you know of other colleagues you have at other agencies or other states, please let them know that we're releasing the solicitation and they're welcome to apply to it. You know, we're still trying to reach some of those parts of our country and other areas of the territories we have to get this information to them. I know we were pretty happy to see, you know, West Virginia was one of those states we didn't have anybody trained in, and fortunately we were able to get a trainer this year from West Virginia. So we kind of finally checked that state off of our box of places to hit. But there's plenty more places we would like to get this information to. So if you know of other people who might want to bring this training to their agency or their community, please forward that solicitation announcement when you do see it go live. At this point, I am going to turn it over to Chan again to give you some more detailed information on the other upcoming GAINS solicitations. I do see some questions coming in the question and answer, and we will do that momentarily. So if you put a question in there, don't worry, we will get to it. But I'm going to turn it over to Chan at this point.
Hi, so I just want to, since, you know, many of you who are on the call were trained through an award that SAMHSA made in response to applications that you submitted for the Train the Trainer program, I just wanted to make you aware that some of the other solicitations that we do periodically, typically annually, will also be coming out soon for our sequential intercept mapping workshops that we offer through a variety of different mechanisms, but we offer it through our SAMHSA Game Center as well. So just if that's something that you're interested in, keep an eye out for those as well. They'll come out right around the same time as the new 2021 or the solicitations for the 2021 training trainers come out.
Okay, so at this point, we're going to have just kind of an open discussion and Q&A. So I'm just going to pop up the Q&A pod so that we can answer these specific questions. But we will do a little discussion if there's other things that come up. It's just a matter of me unmuting everybody. So if, because we have, let's see, we have 149 people on the line right now, which is great. So we're going to go ahead and answer the questions that you've typed into the Q&A box. If you have other questions you'd like to ask us, feel free to throw it in the Q&A box. but I am going to unmute everyone. So if you're in an area where there is a lot of background noise, please try to mute your personal line because it can get a little bit nutty with everybody on. So a little bit nutty.
So, Amelia, can we mute everybody while we go through the questions, and then we can open it up if people want to discuss?
Yeah, that's a good idea.
Yeah. So I can go through most of these. The first question from Tash Petsaf, and sorry if I mispronounced that. Tash asked, of the trainers who delivered the training, what percentage of trainers were law enforcement officers? And that's not actually, that's a great question, but not data that we collect in terms of who the trainers are from the survey. I mean, we certainly know who we've trained, but in terms of the survey itself, that's not a question, so we don't have that information. Will you be sharing the PowerPoint from today's session? Certainly. Yeah, I think we could send that out on the trainer listserv, and I think that we can send a reminder about how to log into the portal and download the training materials. You can do that as well. Vicki, not sure when you were trained. The process is still the same. The login information is still the same in terms of the username and the password that's in your training manual, but the portal should be the same if you were trained through the Game Center, but if not, it's changed a little bit, but we can resend that as well when we send the PowerPoint. And Debbie Westcott asked if possible we send the updates via email. That is something that we do plan to do after this call so that all the trainers, including those who weren't on the call today, will have the updates from version 4.0. So you'll get all of that in one email. Let's see what else we have here. Okay, well, it looks like we answered. Oh, wait a minute. Let's scroll. Very much for the removal of the green cards. You're welcome, Sharon. Hopefully when you all who weren't trained on 4.0 but were trained on earlier versions see the changes that were made to Module 6, I hope you're going to find them a welcome change. I know even for our, trainers that do the trainer events who, deliver the curriculum frequently, it was a very welcome change from almost everybody's perspective. Because we made it easier to facilitate Module 6, so hopefully you all agree with that. And we know for sure that Sharon at least is happy that she doesn't have to use the green cards anymore, so that's good. Let's see. Melanie said, I frequently get feedback from people of color who attend our trainings that they find it offensive and stereotyping, stigmatizing that the videos, the power of traumatic events, and Three Traumas Effects videos are predominantly showing people of color. Have you considered revising those videos to be more representative of a wide range of races? Well, that's a good question, Melanie. And, we've been delivering this training for a while. We've revised the videos at different points in time. We actually used to get a lot of feedback that the videos weren't representative enough of the populations that were, involved in the criminal justice system and the behavioral health system, and that they really weren't representative of the people who professionals came in contact with every day. So I think, that perception is, I'm certainly valid from your perspective, but I think some of it is depending a little bit on where you're coming from in terms of the geographic area, the size of the jurisdiction, the part of the country. So we do really pay a lot of attention to the representativeness of the people who are in the videos. But right now, we're not looking to change any of the videos other than the changes that Amelia already reviewed. But we definitely appreciate that feedback. Let's see, how do you print the presentation? Well, you can't really do the presentation. Let's see. So, Mary, yes, all of these are on the website. No changes to the login at all. So anything that's in your trainer manual, you should still be able to do. And Karen, you can print the presentation, sort of print the presentation if you print the section of the trainer manual off of the trainer website. But we don't have a version of the presentation. If you remember to when you were trained, the training itself is in program Articulate. That is, so it's not like a PowerPoint presentation where you can just print out the slides. So Amanda, I'm going to not address your question verbally, but I'm going to ask Amelia to follow up on that with you. Amelia, I don't know if you want to address that in the chat or you would like to get Amanda's email and you can follow up on that. We get these videos. So the videos, you'll be able to download the new version 4.0 of the training and the Articulate presentation for that, and you'll have the edited video as part of that. So just go to the trainer website and follow the directions just like you did for the whatever version you were trained on, and you'll be able to download the new presentation with the new videos. Monica, that's a great question about, I knew that would come up and I was hoping I would see it here in the chat box about offering the training virtually. And that's something, that we've been talking a lot about, for obvious reasons. All of the trainers that we did this year, we did virtually, but we were training people still to deliver the training in person. We have not yet really talked about modifying how we provide the materials so that it's more conducive to being able to present virtually. I do know that because of how the presentation itself is structured in that Articulate software, that can be a bit problematic with some of the virtual meeting platforms. But that's something that we're working on and we're talking about. We certainly, as part of the Train the Trainer program, have delivered the 4-hour training as part of the 2 days that we spend doing that virtually. So we can do it for sure. It requires, some creativity in terms of how you modify the discussions and the activities. But that's something that we're working on. And I would say keep an eye out for a follow-up for us about that with at least some, tips on how to facilitate the activities and things like that, and perhaps some additional materials to be able to help you facilitate things virtually. And I think, Jody, that also probably answered your question, similar kind of question. Dated to the portal. Yeah, like I said, we'll send out the access information for the portal again if everybody wants a reminder for that. And that. Modified shorter version appropriate for CIT training. We do have, one version that is shorter, but not really geared toward CIT training specifically. Becky, we have a judge's version that's about 2 hours long. So the answer to that question is no, we don't have a modified shorter version. But we have had CIT trainers in our trainer groups and who have used or have planned to use the training as part of CIT training or another law enforcement training program. So I would say there's not a shorter version, but you could certainly use it in, deliver it over multiple sessions if you wanted to think about integrating that into the 40-hour training or whatever the structure of your CIT training is. Let's see. Sharon said, when training case managers from the community outside of the correctional setting, how or what do you say to get them to buy into the fact that their clients could very well be justice involved? One of the things that you could do, Sharon, is you could take a look at, if you haven't already, taking a look at the case manager version of the training. And in there, if you look at the trainer manual for that, a lot of the content notes that are in that training would be very helpful for you to pull out and use as part of I'm assuming you're delivering just the regular 4-hour training, not the case manager version. So I would suggest going in there and taking a look at some of the content notes in the case manager version of the training. And I think those would be really helpful to transfer over to your delivery if you know you specifically want to address a group of case managers who are in your audience. And again, that's all accessible through the trainer portal. I'm not sure how long it's been since you were trained, but if you go in there, the most recent version of the case manager training is the case manager version 2.0. So just like you would access the 4-hour training, you can go on the trainer portal and access the case manager version as well. All right, so it looks like we're to the end of the chat box questions. Amelia, do you want to people raise their hand if they want to ask questions verbally?
We can do that, though I will mention I've received a lot of chats that are private to me that have some questions, so I don't know if it's okay that I maybe ask these questions out loud, because I think they only just went to me as opposed to all the panelists.
Sure. And actually, I think I skipped one question too that Warren Barron had about updates to the additional resources, the treatment of trauma section of the 4.0 resources page. So we have updated some of the resources as Amelia provided an overview for. We haven't really updated that particular resource as part of 4.0, but we have updated and added other resources, and that'll come out on the trainer listserv as part of the summary that comes out following this call. Are you thinking of including human trafficking in the curriculum? That's a great question, Terry. Right now, that's not a part of the curriculum, but perhaps in a later version, we'll answer some or add some content there as well. So the historical trauma section of the original curriculum, this is from Monique Swift. What Amelia mentioned about adding a couple of slides that speak directly to diversity, issues of diversity, equity, and inclusion. We'll speak some to historical trauma for sure, so in that way it will expand a bit. But again, we have that trainer resource on historical trauma that if you or any trainers feel like you want to add additional information, typically on that circumstances affect risk slide in module 4, that reminding you that there is that resource in the trainer resources section of your guide as well, where you can feel free to add additional content to your delivery of the curriculum on that particular topic. Have you added or plan to add more materials on interventions that would enable individuals to have more tools when interacting with individuals, especially those who have been traumatized? So I'm not sure, Becky, if you're talking about like clinical treatment sorts of interventions. If that's the case, we're not going to add that kind of content to the training. That's sort of outside the scope of the training. So hopefully that answered your question. If not, feel free to type again in the chat box.
Yeah, and Becky, I can unmute you too if you'd like to expand on your question a bit more.
Thank you so much. So no, I am aware that clinical treatment is definitely outside the scope, and of course I come from a clinical background because that is my degree. But I am really referring more to, I know that it's been quite a while since I've taken the training, so I apologize if there's been some adjustments made since that I'm not aware of. I have not really looked at the newest module, and I honestly I missed a couple, like 15 minutes of this presentation, so I apologize in advance. But I know just from the very beginning, I felt that when I went to the training that we received a lot of information about trauma and about how people are impacted by trauma. But I didn't really feel like we could honestly give the officers a lot of direction on what they needed to do besides have awareness, give them space. You know, those simple little things like giving them space, being aware of their surroundings, how they interact, what kind of communication to use. Those basic skills and tools and techniques is what I'm referring to.
Okay. Yeah. So we have some resources that are in the trainer manual that speak to that, but you're right. We don't have, a specific. We're certainly not part of the training. A really very, intensive training on that. And it's primarily Module 5, and Module 5 is designed to be broad enough that it's applicable for anyone who's really, in the room, regardless of their role within the justice system or the behavioral health system. But, I think one of the things that we can do is take a look at some of the resources and links that we provide, and perhaps add additional links to, or maybe even think about developing a fact sheet that would speak a little bit more to that, so that trainers have that information. If that's, something that they want to go into. I think one of the best ways to get that information across, which is something that we do encourage when we do the TTT, is if you're going to be training groups of officers, especially with that module, to have a law enforcement officer co-train with you. Even, if they don't have, within the timing of the training, don't have enough time to drill as deep, we find that having that type of person be a co-trainer, especially for that module, can make it more relevant for the law enforcement officers in the room. So that's a suggestion, but we'll definitely take that comment back under advisement for additional work that we're doing. Carrie asked about making the training longer. No, we're definitely not going to make the training longer, but if you find that you need more time to cover a particular set of content, or there's content that you want to elaborate upon, you're always free to modify that as long as you're building in time for that. We've created it as a 4-hour training. We train it as 4-hour training. We ask you to, try to stick to that, but certainly if there is additional information, if you do want to go into more depth on, that's totally, you have free license to do that as a trainer. So that would be my suggestion there. So Sharon, I think you were referring to the resources at the end of the trainer guide. And yeah, you can absolutely use that to teach off of. I mean, again, we provide those resources as additional content that you can use to augment your delivery. And it kind of goes along with that, you can make the training longer, as long as you're building in time for topics that you want to spend more time on that might be than what might be allotted for that, that's absolutely fine. I think we kind of already talked about converting the presentation to a virtual platform, so I would say stay tuned on that. Okay, great suggestions. So I think we've, looking at my time here, so we have 3 minutes left. And I don't see any more questions in the chat box. But Amelia, you said there were some other ones in the private chat, or the things that we haven't answered yet that we want to tackle in the last couple of minutes here.
Yeah, that would be great. Most of the questions I got in my private chat were around virtual training, so we've largely covered that. Please stay tuned. We are hopefully going to work on that and get you something soon. But the other The other question I have specifically in here just came in, and it says, it's from Kelly. It says, in Harris County, the consistent feedback we have received from our participants is how to cope with vicarious trauma as well. And do we have plans to develop a follow-up training specifically for vicarious trauma?
Yeah, no, we don't have plans. I mean, that's a great question, and that's one of the major changes in version 4.0 is that we added quite a bit of information about vicarious trauma and direct experience of trauma and kind of the impact that that can have on people who work in the criminal justice system, both personally and professionally. We don't right now have plans to develop a companion training that is specific to vicarious trauma, but definitely check out, if you haven't been trained on version 4.0, check out the changes to version 4.0 specifically with that content. So I would say in closing, if there are any other questions that we didn't answer or things you want to follow up on or you didn't like our answer and you want to talk more about it, just, reach out to Amelia or to our PRA email address that Amelia has up on the screen here, and we're happy to follow up. And like I said, keep your eye out for a follow-up message to this webinar that will have that document that shows the changes in version 4.0 and some of the additional follow-up material that we talked about during the conversation. Amelia, I don't know if you have any last things you want to say?
Yeah, no, just what you said, and the other people that had sent me private chats around some technical issues, I put my email in the chat box there for everybody. Please contact me directly at aallen@prainc.com for any technical questions. Every system's just a little bit different, so everybody has a slightly different answer, so that's all.
Thanks, everyone.
Thanks so much.